Dr. Tony Nolly here. I'm here to talk to you about the head weight package that you received from your doctor. When you get your head weight, it comes in a box of this, and you unpackage it, open it up, and the package comes with a couple of different pieces inside. As you take it out of the cellophane, what you're going to find inside of here is going to be the actual harness that carries the head weight and then an actual strap. The strap has a little bit of padding here now for your forehead. So I'm going to go ahead and unvelcro this so you can kind of see what we have. And then when you open this up, you're going to have head weights in here. You're actually going to have weights. Each bar itself is a half pound. It's a half-pound bar. Most patients will be prescribed 2 to 4 pounds up here. So I'm just going to set it up for a normal 2-pound setup. So you're going to take these out. And that's going to be your typical 2-pound setup. Now, however, sometimes you're going to have 2 pounds in the center, so you can actually double these things up by putting 2 weights in one pocket. That's totally appropriate too. Your doctor will set up your configuration for you in terms of how he wants you taking it. So I'm just going to kind of set up for this normal version here, like that. And then you're velcro this down. And when it's velcro down, it's very secure. The weights don't fall out. It's nice in place. What you don't want to do is share your configuration with somebody else. You don't want to have like you wearing a 2-pound and somebody else wears a 4-pound and you're sharing somebody's other configuration. That's not recommended because it's going to be prescribed just for you. The way the head harness works, this is the part that attaches to your head, has a couple different adjustments that you can do to it for comfort. Is that this thing will come around the back and kind of goes through this loop and locks in. And then it creates this kind of headband. And then you have these 2 other straps. This one will come across this way and velcro through this loop, just like that. And then this one will come from the front and come around this way and velcro through here. So it creates like a little hat and it'll go on top of your head like this. This is to create a little bit of resistance so the weight doesn't drop down over your face. And then you make this as tight as you possibly can when you put your weight on. And I'll show you a little bit more when we actually set this on the patient. Okay? But that's your configuration. This is all the pieces that you should be getting. If you have extra weight, I know the weights come standardly with 3 pounds, but you're going to need a 1 pound or a 2 pound. Just hold on to those bars because you may need them in the future. But follow the configuration that's prescribed for you.